My name is Ryan Polselli. I am the owner of 3D Mobile Mammography by Mammolink, which is our company. And predominantly, we do service most of our population, breast cancer screening and diagnosis through mobile mammography. But we are not a mobile mammography company per se. I would say that if you were to ask what the heart of the company is, and we are a patient advocate company that happens to specialize in breast imaging and breast cancer screening and diagnosis. That's kind of what we are. And it just so happens that one of the most effective ways that we've found to service our patients is through mobile mammography. So we have 4 units now, probably a 5th coming soon. And we've been pretty successful with, I think, sort of disrupting the current status quo of breast imaging in this area to try to break down some of those barriers and increase participation in screening. Medicine's very good about the practice of medicine, but not necessarily so good about the practical implementation of it and how it directly relates to patients' lives. And that's our goal, to get better at that part of it. The reason that I chose RamSoft is it's probably one of the biggest, if not the biggest decisions that you're going to make in terms of how you want to build things around the patient. From the radiologist perspective was reliability. What's the one PACS system that has had the least number of issues? And it was RamSoft. So for me, that was the number one consideration. I just wanted something that would work, especially with mobile, which is so interdependent on so many different factors, and there's so many things that can go wrong. The one thing you can't have go wrong is your PACS system. And so I knew that it's basically web-based and uses the Microsoft Azure servers and this and that. That's why we chose that in terms of reliability. The ability to tailor this to our patients. So we really started with the patients at their needs and what they wanted, and then we worked backwards. Well, what do we need to have in place for that? And there was a lot of tailoring to this. Patients being able to get their reports right away, that was very important to us. RamSoft was able to do it. Being able to send studies and pre-cache studies, since tomos are so large, the file size is huge. It was very important to us to be able to pre-cache studies at different locations, wherever we want to be. And then just being able to get them off the buses through the gateway, which we're using on all of our buses, and to be able to transfer big files and quickly. That was also a close second in terms of important features for us in choosing RamSoft. And then I think the last thing that I would say is the accessibility. So it had a patient portal, as physician portal, the patient PAL integration, which we like and we're using, so patients get their text. Some of the patients will get on the bus, they'll have their mammogram, and literally if they've, spent 5 minutes talking on the bus with something, as they're walking off, they'll get the report texted to their phone. And that's just, they love it. They're amazed by it. And that was important to us. And so that was kind of the last piece, I think, that made me choose RamSoft. We are now starting to do mobile diagnostics, and this is only possible due to the solution with the gateways, getting the images off the bus quickly. So we can do essentially in real time diagnostic workups from me being in a remote location. So I could still potentially be at my house, and one of the mobile buses is doing a diagnostic day, and those images will come across right to my secure view workstation and the RamSoft right there within a minute. So there's no delay to the patients, and we can I can call them via phone and say, okay, we'll get this view or get the ultrasound or not, that type of thing. And that's been huge, and that has been very, very important. Especially in terms of the reliability, the images get there and it's quickly, so that you can pull this program off, and it's paid off. This is a kind of a special story. A 37-year-old patient, this was about a month ago, who had a lung on a Friday. Hey, I'd like to get in. Well, guess what? We're going to be in your neighborhood on Saturday. So she came to the bus on Saturday. We did a diagnostic, and in the other breast, she had some calcifications, which wasn't even what she came in for, but we were able to work those up on the spot right there on a weekend. And turned out to, need a biopsy, and we had her in for biopsy by a Wednesday. So that is something that I'm pleasantly surprised about. I didn't know how well it was going to work, but it's working fantastic. And I think it's paying off.